Did you know 80% of the 10 million Americans with osteoporosis are women? Even more alarming, nearly 1 in 2 women over 50 will break a bone because of it. In this video, we'll uncover what causes osteoporosis in women, and more importantly, how you can prevent or manage it. Whether you're young, nearing menopause, or postmenopausal woman, it's time to take control of your bone health. Causes and risk factors. Now, why are women more at risk of developing osteoporosis than men? Let's start by understanding the root causes. Women tend to have smaller and thinner bones compared to men, which makes their bone structure more vulnerable. But that's not all. One of the biggest factors lies in the hormonal changes that occur during menopause. During menopause, a lot changes in your body, and one of the most significant changes is the drop in estrogen levels. This hormone is essential for keeping your bones strong. After menopause, when estrogen decreases, your body starts losing bone mass faster than it can be replaced. In your bones, 2 types of cells play an important role. Osteoclasts. These cells break down bone. Osteoblasts. These cells are responsible for bone formation. After menopause, a decrease in estrogen enhances the activity of osteoclast bone breakers, while inhibiting the function of osteoblasts, bone builders, resulting in bone loss. Additionally, cortisol, the stress hormone, is harmful to your bones. Cortisol levels rise, which stimulates osteoclasts while inhibiting osteoblasts. This indicates that more bone is broken down while less is rebuilt. Normally, your ovaries and adrenal glands generate the feminine hormones estrogen and progesterone. However, when you go through menopause and your adrenal glands are too weak to compensate for the decline in estrogen, you get even lower estrogen levels and increased cortisol, which accelerates bone loss. A woman's bone density might drop by up to 20% in the 5 to 7 years following menopause. This abrupt loss can raise the likelihood of developing osteoporosis. While osteoporosis is more common in older people, it can also affect young women in their 20s, 30s, and 40s, even before menopause. These women are called premenopausal, which means they have regular menstrual periods but have not yet attained menopause. Although uncommon, certain young women may have low bone density, increasing their chances of getting osteoporosis later in life. One important component is low peak bone mass, which can be caused by genetics, medical disorders, or drugs that promote bone loss. This type of bone loss is known as secondary osteoporosis. Idiopathic osteoporosis is a condition in which bone loss occurs for unknown reasons. Women with secondary osteoporosis are frequently affected by underlying illnesses or long-term pharmaceutical use, such as steroids, which weaken bones over time. The risk is not limited to women going through menopause. If you experienced early menopause before the age of 45, or if you had a hysterectomy, particularly one that removed the ovaries, your risk increases even more. These diseases cause early hormonal changes, depriving your bones of the estrogen they require to maintain strength. Even missing periods for more than 6 months owing to excessive exercise or intense dieting might disrupt estrogen levels and weaken your bones over time. Eating disorders such as anorexia or bulimia can also cause bone injury at a young age. Did you know that almost 1 in every 2 women over the age of 50 will break a bone due to osteoporosis? That means half of all women face an increased risk of fractures, particularly in the hip, spine, or wrist. In fact, a woman's risk of breaking her hip is the same as her combined risk of breast, uterine, and ovarian cancer. These figures aren't designed to scare you. They're intended to promote awareness. Because the truth is, osteoporosis is avoidable, and even if you already have bone loss, there are many things you can do to treat it. Diagnosis. Diagnosing osteoporosis in premenopausal women is difficult, and bone density tests are not commonly suggested for young women. There are several causes for this. There's a low risk of fracture. Most young women with inadequate bone density aren't at high risk of breaking a bone very soon. Genetic factors. Some women may have poor bone density owing to heredity, and no treatment is required to increase their bone mass. Inaccurate test results. DXA bone density testing can occasionally underestimate bone density in smaller or thinner women, resulting in potentially misleading results. Bone density examinations are typically done for young women who have fractured many bones or have an underlying disease that causes bone loss. These tests help assess the amount of bone in specific areas, such as the hip and spine. If a second test shows a significant drop in bone density, it could indicate ongoing bone loss, requiring further evaluation. If you're approaching menopause or fall into one of the higher risk categories, such as having a family history of osteoporosis, early menopause, or a history of fractures, your doctor may advise you to have this test sooner rather than later. In addition to the DEXA scan, your doctor may look at your medical history, lifestyle, and other tests like blood or urine testing to rule out secondary causes of bone loss, such as calcium or vitamin D shortages. If you've had repeated fractures or suspect you have a bone problem, early detection is critical for avoiding further harm. But before we get into the therapies and prevention techniques, consider what occurs if osteoporosis is not addressed. When your bones grow brittle, even simple daily actions might become perilous. Slipping on a damp floor or bending down to pick something up can result in fractures. For many people, this could mean losing their independence, living with chronic pain, or undergoing procedures, all of which include dangers. The good news is that osteoporosis does not have to be a natural part of aging. Treatment. So what can be done? The first step is to acknowledge that you're not helpless in the fight against osteoporosis. You may strengthen your bones by adopting healthy living choices. And if you think you're too young to worry about it, reconsider. Teens and young adults have a unique opportunity to develop strong bones early in life. Your bone mass peaks in your late teens and early 20s, and whatever you accumulate during this period serves as your bone bank for later in life. The first step is to reduce your daily stress levels. Stress has a huge impact on our general health, but it can be especially hazardous to bone health, particularly for women with postmenopausal osteoporosis. Stress causes the secretion of cortisol, the body's main stress hormone. While cortisol serves a useful purpose in brief spurts, such as helping you respond to acute dangers, persistent stress causes high cortisol levels, which can have major effects for your bones. Elevated cortisol levels from continuous stress boost osteoclast activity, which breaks down bone and hinder osteoblast function, responsible for bone formation. This lack of balance leads to faster bone loss. Over time, this can result in diminished bone strength and raise your chances of developing osteoporosis. The link between stress and bone health underscores the significance of discovering efficient methods to handle stress in your daily life. How can you reduce the negative effects of stress on your bones? Here are a few useful tactics. Engage in mindfulness and relaxation methods like meditation, yoga, or deep breathing to relax your mind and decrease stress. Spending a few moments daily to focus and ground yourself can result in noticeable advantages in the long run. Participate in regular exercise. Regular physical activity not only enhances bone strength, but also serves as a natural way to reduce stress. Find an activity you like, such as walking, dancing, or lifting weights, and incorporate it into your regular schedule. Stay in touch with loved ones. Developing and preserving strong connections can help protect against stress. Make sure to allocate time for family and friends, and be open about your emotions with loved ones. Give importance to sleep. Getting good sleep is crucial for healing and handling stress. Strive to get between 7-9 hours of peaceful sleep every night in order to allow your body to rejuvenate. The second item is physical activity. Physical activity is essential. Engaging in weight-bearing activities such as walking, running, or dancing promotes the formation of bones. Strength training, conversely, assists in developing muscles that provide support for your bones. The key is to remain active and ensure your bones and muscles are involved. Although it is important to exercise, it is important to note that smoking and drinking too much alcohol can have a harmful effect on your bones, increasing your risk of osteoporosis. Let's not overlook the role of diet. Adding the correct nutrients to your diet is just as essential. Let's closely examine some important nutrients that help maintain bone density and overall well-being. Calcium is essential for bone and teeth health as it is a mineral that supports the strength of bones and teeth. It has a vital role in the structure and function of bones. The suggested daily intake of calcium depends on age and gender, with adult females typically requiring 1,000 to 12 mg per day. Calcium is present in a variety of foods, including dairy items like milk, yogurt, and cheese, provide a high amount of calcium. Choose grass-fed dairy whenever you can, as it might provide extra health advantages. Leafy greens such as kale, bok choy, and broccoli are high in calcium, making them excellent choices to include in your diet. Fortified foods. Calcium is added to plant-based milk alternatives such as almond or soy milk, and breakfast cereals to help increase your calcium intake. Vitamin D, known as the sunshine vitamin, is crucial for calcium absorption and the health of our bones. Lack of enough vitamin D prevents your body from properly utilizing calcium, resulting in potential bone loss. Increasing your vitamin D levels is possible by sun exposure. Try to get 15-30 minutes of sunlight a few times a week, varying based on your skin color and where you are. Fatty fish like salmon, mackerel, and sardines provide a rich source of vitamin D. Egg yolks and fortified foods both have vitamin D, with dairy products and cereals often enriched with this vitamin too. Vitamin K2 is frequently ignored but is essential for bone health as it helps guide calcium to bones and teeth, preventing it from accumulating in soft tissues. Including foods containing high levels of vitamin K2 can greatly improve the health of your bones. Natto, a type of fermented soybeans, is known for being extremely high in vitamin 2. It is also present in other fermented foods, such as sauerkraut and kimchi. Animal-based foods such as egg yolks and select cheeses, particularly those sourced from grass-fed cows, offer vitamin 2, diversifying your dietary options. Both magnesium and boron are necessary for maintaining bone health since they assist in controlling calcium levels and promoting overall bone structure. Magnesium can be found in foods such as almonds, pumpkin seeds, and sunflower seeds are great sources of nuts and seeds. Whole grains such as brown rice, quinoa, and whole wheat bread are additional sources of magnesium. Even though it is required in smaller quantities, boron is crucial for preserving bone density. Boron can be located in fruits like apples, pears, and grapes are all excellent sources. Beans and lentils offer a beneficial amount of boron, which helps maintain healthy bones. When nearing menopause, it is important to talk to your healthcare provider about your bone health. If you're at increased risk, they might suggest bone density testing. These exams assess the amount of bone present in your hip, spine, or other skeletal structures. Having low bone density doesn't guarantee osteoporosis, but it's a warning to take steps to safeguard your bones. One choice recommended by your healthcare provider could be hormone therapy, such as estrogen therapy (ET) or a combination of estrogen and progesterone hormone therapy (HT). These treatments may prevent bone loss and control menopausal issues, such as hot flashes. Nevertheless, there are potential dangers involved, including a higher risk of breast cancer, strokes, heart attacks, and blood clot. Having this discussion with your doctor is important in order to consider the risks and benefits in relation to your health background. Medications are accessible for individuals with osteoporosis or a high risk to decrease bone loss or promote bone rebuilding. This includes bisphosphonates, which slow bone breakdown, and other medications that promote bone growth. Although not typically approved for younger women, some cases may warrant the prescription of osteoporosis medications. For example, women who have used steroids long-term or experienced multiple bone fractures could see positive results from these therapies. It is equally crucial for pregnant or breastfeeding women to prioritize bone health. Make sure you're getting sufficient calcium and vitamin D for your baby's developing bones. Thankfully, research indicates that if you undergo bone loss while pregnant, you typically restore it afterwards. And can you imagine? Studies indicate that having children could reduce the likelihood of developing osteoporosis in the future. Take action now, no matter your age. And if you're curious about how to reverse osteoporosis without medication, check out this video.